So we're going to be doing an IM and sub-Q injections today. But before we start, when giving medications, it's important to look at the MAR and the doctor's orders to make sure they're correct. And before giving your medication to your patient, you have to make sure you have the right aids for medication. So the right patient, right dose, right patient, right dose, right medication, right route, time, frequency, documentation. And before giving your medication to your patient, it's important to know if they have any allergies, as well as to look at their patient's build, their size, their weight, muscle mass, when you're going to be using that as reference to which needle you should use, like for the gauge and the needle length. Okay, so this type of needles that we'll be using for sub-Q and IM differ. So for sub-Q, you're going to be using a 25 gauge needle with the 1/2 inch needle length, and then for IM you're going to be using a longer needle so it can get into the muscle, and that will be a 22 gauge needle with a 1.5 inch. We've got a medication, and this is heparin. So the doctor ordered 5,000 units of heparin, and the dosage strength is 5,000 units per milliliter, therefore we'll be taking out 1 milliliter of heparin. And the second medication we have is Haldol. Doctor ordered 1 milligram of Haldol IM, so we'll be taking out, and the dosage strength is 4 milligrams per 2 milliliters, so we'll be taking out 1/2 milliliter of Haldol. When preparing medications, it's very important to perform hand hygiene aseptically, so that when you're bringing your medication into Mr. Manzini's room, you're not transferring any bacteria, and as well as putting on gloves when you enter his room. Now we'll be assembling the needles. So for our sub-Q, for our IM actually, we're going to be using a 3 milliliter syringe, and we'll be using the 25 gauge needle, and we will be just screwing that one on, as well as for IM, we'll be using a 1 milliliter syringe with our 22 gauge needle, and we'll be screwing that one on as well. And then you have your 2 needles ready. So you're going to take your alcohol wipe, and you're going to wipe off the vial. So this is going to be our heparin. You're going to wipe that off for 15 seconds. After you've done that, you're going to draw back. You're going to take your 3 milliliter syringe, draw back 1 milliliter of air. Okay. And then you're going to take that, and you're going to push that back into the syringe, into the vial. And then you're going to take it up, and you're going to draw it back, not touching the plunger, and you're going to draw 1 milliliter. Okay. And then you're good. Once you've drawn out 1 milliliter, you're going to flick out any air bubbles to the top. Okay, and then you have no air bubbles. Cap, you're going to want to take the needle cap itself and put it against a hard surface. Grab the needle and place it up against there, and just do that. For second medication, we have Haldol, and we're going to be drawing back 1/2 milliliter. So you're also going to cleanse the top of the vial. Again, pop that off. Wipe that for 15 seconds. Once you've done your 15 seconds, you're going to take your 1 milliliter syringe, and you're going to draw back 1/2 milliliter of air. Okay. And then you're going to inject that back into the vial. And you're going to tilt it upside down and hold that back without touching the plunger. And then you're going to take out any air bubbles as well. So now we're going to do our needle capping technique. So same thing as last time, you're going to put it up against a hard surface, and then you're going to do this, and now you have your cat's needle. before you leave to go into Mr. Mancini's room, it's important to label your medication on the needle and the syringe so you don't mix them up, as long as the dosage strength. So we'll be labeling for Haldol and heparin, so we'll be labeling this right now. As well as the dosage strength, and then, so it's for heparin, and now this one will be for Haldol. Then you take that, you label, and you write it on here. You just wrap it around the needle so you know which is for which. Okay, so now you have your labeled needles so that you don't mix up the medication, and then you know the exact amount of medication that is in these two. Now that we've done preparing our medications, it's important that we clear up our area, making sure that we throw away our things in the appropriate bin so that we don't leave a mess for next time. Now that we've cleared off our area, I'm going to make sure to prepare hand hygiene and put on a fresh set of gloves before entering Mr. Mancini's room. Again, to prevent transfer of bacteria. Entered Mr. Mancini's room, we're going to ask for his name so we can compare it to his name and date of birth so we can compare it to his MAR, and the medication to make sure we have the right dose and medication for the patient. And then when we're injecting it, we'll be injecting it into his lower abdomen, and there's other spots that you can inject. It would be the abdomen, the back of the forearm, or the side of the thigh. And we're just going to inspect the area to make sure there's no bruising or lacerations or anything in the area. Inspected the area, we're going to take an alcohol pad. We're going to start from the center and clean out for 2 inches out. Okay, and then we're going to take the needle off, and we're going to go in at a 45-degree angle. So you're going to hold it like a dart, but first you're going to pinch the skin so that you get a layer of fat. Should go at a 45-degree angle, and then you're going to push in slowly. Leave it in for a bit, and then you're going to take it out swiftly and immediately apply pressure to let it form a clot since this is a blood thinner. And then you're going to throw this out in the appropriate sharps container. Muscular injections, there are 3 places you can put it: your ventral gluteal, vastus lateralis, and your deltoid muscle. So for this injection, we're going to be doing it into the ventral gluteal. So landmark it, you're going to put your palm at the top of the thigh bone, and then you're going to put your thumb facing the stomach, finger towards the iliac crest, and in this triangle here is where you're going to be administering your medication. So you're going to swab the place, going from the inside out to 2 inches, and then you're going to do your landmarking again, and you're going to place the cotton pad where you're going to inject so you don't forget when you get your medication. So when you do get your medication, you're going to uncap, do your landmarking again, and you're going to do a 90-degree angle into the muscle, and now you're going to draw back a bit to make sure you don't have any blood, and if you do, you're in the wrong spot. Now that we don't have blood, I'm going to make sure to inject slowly. And you're going to pull straight out, and you're going to put the alcohol swab on it. Dispose your needle in the sharps container and hold that down so that, yeah. You're giving your injection, you take off your gloves, put them in the garbage, perform hand hygiene again. And when documenting, it's important to note how he tolerated the medication, if there were any concerns he had. Also, make sure you sign off in the MAR that you did get the medication, and just document how he felt and how he tolerated everything.